It is that time of year when germs seem to be everywhere. Newsroom, your work, everywhere.
Yes.
But doctors say everything you need to make your child feel better is probably already in your home.
Although they're the reason we're all getting sick. In this week's Wellness Wednesday report, Channel 3's Caitlin Nuclo tells us the 5 things parents need in their medicine cabinet to survive cold and flu season.
Wellness Wednesday is sponsored by Total Fitness Equipment.
Cold season is upon us, and flu season has actually already started. We've already seen cases of positive flu, which is actually kind of early this year.
'Tis the season to be sick. But Dr. Charlene McStay says parents don't need much to help their kids feel better.
You don't need a sort of a medicine cabinet filled with medicines to treat things. A lot of the stuff you probably already have.
First on the list, a trusty thermometer.
A lot of people think that they can just, tell their child's temperature just by touching their forehead, but most of the time you actually can't. For people who have babies at home, they should have a rectal thermometer because those give the most accurate measurements.
She says a temp above 100.4 is considered a fever. Another thing to have on hand?
Kids can be pretty uncomfortable when they have fevers, so I usually tell parents that they should also have some kind of fever reducer on hand at home. So being acetaminophen or ibuprofen, because those things can make their kids feel much more comfortable when they do have a fever.
But she says you don't have to give it for a fever, only if your child is really uncomfortable. The pain relievers can also be used to treat head or earaches. Next up, saline drops for stuffy noses.
You can buy them over the counter. They come in both drop form and also sprays for older kids. For a baby, you can put 1 or 2 drops of the salt water in their nose and use one of those bulb suctions that they give you in the hospital when your baby's first born to kind of pull out some of that clogged mucus, and that can actually make them feel much more comfortable.
Humidifiers also help sick kids breathe easier. And lastly, honey.
Honey is actually clinically proven to help coughs, particularly at nighttime. You can mix it in with some warm water, or you can just give it to an older child off of a spoon and help treat their cough that way. The only thing with honey to remember is just that anyone under the age of 1-year-old should not be given any honey because of a risk of a dangerous infection.
Something you don't need in your medicine cabinet?
What a lot of people don't realize is that over-the-counter cough and cold medicines are actually not recommended for most children, and that's because studies really show that they're not very effective for young children, and then on top of the fact there is a risk of dangerous side effects from these medicines.
That's your Wellness Wednesday report. I'm Caitlin Nuclo, Channel 3 Eyewitness News.